lens that really helps you understand your drop of blood tracing. It helps you understand the function of the heart and where things are going. So looking at just the right half, the blue half, you have your vena cavas, which are coming in. This is your right and left brachiocephalic veins that drop into the superior vena cava. Here's your inferior vena cava, and these are dropping into the right atrium. You have your auricle, which allows for expansion for pumping. You have your pectinate muscles, which line the entire atrium, but are only shown on the door flap. You have your sinoatrial node, which begins the process of electrical conduction, and that causes the atria to contract. Then that travels to the atrioventricular node, so your SA node and your AV node. The AV node has a pause, and then it spreads into your ventricles by following the bundle of His, then through the His fibers, then up through the Purkinje fibers.
Where's the bundle of His?
You can't see the bundle of His. These are the His fibers. But the bundle of His goes from here to here.
Oh, okay.
The white are the His fibers.
Yes, the white are the His fibers. And this is the Purkinje fibers. And you'll see that on both sides too. So there's the His fibers and the Purkinje fibers.
Okay.
So that causes a slight delay, and then it causes the ventricles to contract. So that's your electrical conduction system of the heart. Inside the atria, blood comes in from 3 locations. It comes in from the superior vena cava, the inferior vena cava, and this little guy right there. What's that?
I read it earlier.
It's the opening to the coronary sinus.
Yes, because that's where all the other ventricles,
It opens
from
to
the heart.
Exactly. It opens to the inside of this, so it's going to show up just above the inferior vena cava. And if you look inside, you'll see it just above the inferior vena cava.
Okay.
So that's coming in from the coronary sinus. So the blood flows into here. This is the fossa ovalis, which as an embryo is open through between the 2 atria, and that would be the foramen ovale.
It closes after a couple days.
Yeah, a couple days of birth it closes. Okay. And that's going to drop into the atrioventricular valve, which has 2 names. It's the tricuspid valve, and it's the right atrioventricular valve. So 3 roots, 2 names. 2 roots, 3 names. The valve covers are connected by the chordae tendineae, which attach to the papillary muscles. These are not papillary muscles. These are trabecula carne, which always reminds me of carne asada. So the trabecula carne, what is its function?
Allow the blood to flow more efficiently.
Right.
To be all pushed into the...
It prevents the blood from pooling.
Oh, okay.
Because it's such an odd shape and it's not smooth, the blood flows around in this rather turbid, rapid fashion with lots of vortexes. So it gets all the blood swirling and mixing, and it prevents any of it from settling at the bottom, which would create a clot. And if pieces of that clot broke off, they could cause coronary embolisms and thromboembolisms and all sorts of problems. Basically death. So, and a painful one, yes. A rapid one, too. So, that's what the trabecula carne does for us. Then it rises up into the semilunar valve, which is also the right semilunar valve, which is also called the pulmonary valve. And that drops into the pulmonary, well, goes into the pulmonary trunk, which separates into your pulmonary arteries. Here and here. And that goes out to the lungs. From the lungs it'll come back, and now we're on the left side of the heart. So it comes in through the pulmonary veins, which are these red ones, 2 here, 2 here. Both of them come into the right atria, and you can see 2 here and 2 there. So you have a total of 4 openings in the atria, all from pulmonary veins. The right atria still has pectinate muscles, and on this model it looks like they're going in opposite directions from each other, but they're really not when you put them down and close them, because these are going up like this, and these are going up like this.
What's the
So they're
difference
really going in the same direction.
pectinate muscles and capillary muscles?
Capillary muscles are where the roots attach. Pectinate muscles are the contraction of the atria, which allow for expansion and distension. Trabeculocarne are the pattern that keeps it from settling or pooling by changing the flow so it's rapid. Now, the bicuspid valve has three names: the bicuspid valve, the mitral valve, and the left atrioventricular valve. That drops into the left ventricle. Then it's pumped up through the left semilunar valve, which has two names: left semilunar valve and aortic valve, which goes into the aorta. And there it would leave the heart. Now, why is it called a mitral valve?
That I can't tell.
You ever seen the Pope?
Oh, he said
Yeah.
that. It's the hat.
Yep, the hat.
Okay.
The hat that the Pope wears is called a mitre. And your religious Catholic Italians who are dissecting hearts and people back then from bodies they dug up looked at it and said, it looks like the Pope's hat. So they called it a mitral valve. Once again, childish naming that sounds good because it's in a different language.
Either section.
Sounds smarter than it really
It
is.
sounds smarter than it really is. Yeah. Alright. Then you have your blood vessels of the heart. Now, I'll leave that closed. Your right and left coronary arteries,
The way?
right and left coronary arteries, both come off of the aorta. So there are two that come off of it and drop down. So your left coronary artery kind of drops right down through here, and it turns off, and this goes all the way around to connect, and that's called the circumflex, all the way around the back. This is the left. The left coronary artery covers all of this area. And then you'll have your middle coronary artery, which goes through the two ventricles right in between. And this little guy over here is called the marginal artery. So then it drops into our veins. So for the veins you have greater, middle, and lesser coronary veins. This is your greater coronary vein. This whole thing right here. And here, where the marginal vein and the greater coronary come together, it is the beginning of the coronary sinus. This whole thing is the coronary sinus. Over here you have your lesser coronary vein, and you have your middle coronary vein. So lesser, middle, greater, all drop into the coronary sinus. And the coronary sinus is going to drop into the right atria through the opening to the coronary sinus. So that's the coronary circulatory system. And we've already talked about one of the features of embryonic development, which is the fossa ovalis, though in the embryo it's the foramen ovale. The other one is this guy. This guy is the arteriosum, ligamentum arteriosum, but in the infant stage it's open, and it's the arterial ductus arteriosus. Yes. The ductus arteriosus, which closes and becomes the ligamentum arteriosum.
My duct goes to a ligament.
And just for understanding where this is the trachea, this is the esophagus.
I think we covered it.
Okay, that's the heart.